ARK Seminar. It's the last seminar in this series, that is the series of the academic year 2006 and 2007. A lot of familiar faces here. You will be surprised that Gillian Robinson is not opening the seminar as she usually would, the art director. Gillian is away on business in Maastricht, so she's abroad and can't be here today. And I was nominated to chair this session and step in for Gillian. And I suppose the main reason for that is that I have a certain affiliation with the project we are going to hear about today, and I'm very pleased to welcome Emma Larkin, our presenter today. Emma works at the Institute of Childcare Research at Queen's University in Belfast, and she's going to talk about children in care, children and the pathways to permanence, and that's a project that she's going to introduce in a minute. ARK often presents seminars based on material that we collect ourselves, and for those who are not familiar with ARK, which is an initiative by the two universities in Northern Ireland, the two big projects where we collect data ourselves are the Northern Ireland Life and Times Survey and the Young Life and Times Survey. I myself are the director. I'm the director of the Young Life and Times project in ARK. And we have one other project which is to do directly with children, and that's a children's database where we make information available about research on children in Northern Ireland, and that's kindly funded by the Office of First Minister and Deputy First Minister here in Northern Ireland. Right, without further ado, I pass on to Emma. The format usually is that we have a presentation for about 30 minutes, and afterwards there's time for questions, and afterwards lunch, which is being prepared for you outside. So, welcome Emma, and enjoy the presentation.
Thank you. I'd like to start off by thanking ARK for inviting us to come here today. We're absolutely delighted to be able to share some of our preliminary findings of our Pathways report with you today. As Dirk mentioned, I'm Emma Larkin, and I'm a researcher at the Institute of Childcare Research at Queen's University. And I'm here together with Dominic McSherry, who's the principal investigator of the Pathway study, and also Monty Farrat, who's just joined us, and she's helping us to make sense of some of our findings for dissemination. I'd like to point out before I start really that we've just finished and submitted our final report and have received our peer review comments. So we're at the very early stages of beginning to think about our findings and what they mean. And we're really starting the process of exploring what are the key implications of the findings for practice. And hopefully at the end of this there might be some discussion where we would really be interested in hearing your views and views as to how the findings can make sense to you. So it's a work in progress as such. We have a long series over the summer now of organising and presenting this information. Also I'd just like to point out before I start as well that the research is primarily funded by the Research and Development Office, and a small part of funding for one phase of research was also provided by the SSI in Northern Ireland. And before I go on as well, I'd just like to apologise to ARK for giving them heart failure by we had to take in a wrong turn en route. So we're glad we arrived and be able to start in time. So really just to describe a bit about the study. It's a longitudinal study based at the Institute of Childcare Research and is primarily funded by the R&D Office. And the aim of the study really is to examine placement patterns and outcome for a full population of children who were under the age of 5 and looked after in Northern Ireland on March 31st, 2000. And really it was to see where they were, what types of outcomes they encountered, and how they appeared to be getting on within the placements. So we had three key research questions, which are: what are the key placement outcomes for the population? What, if anything, predicts these placement outcomes? And how parents feel the children are getting on within the placements. Because we're working within Northern Ireland, we're quite lucky in that the size of Northern Ireland has allowed us to track a full population of children under the age of 5. And really, we're lucky in that we're the only UK study that's able to do that and to examine a full population rather than a subsample, which is what normally really happens in this type of research. Research tends to focus on subsamples of children at particular ages and doesn't necessarily follow all of the potential placement outcomes. So for example, a study might be focused on, say, 4 or 5 local authorities and might look at foster care, for example, but we're able to look at the complete picture, which is really good. Another positive feature of our study is that it's one of the few studies that is able to look at the experiences of young children in care. And Word et al. Highlight our study as one of the few studies that's able to do this. They state that surprisingly little is known about the experiences of very young children in care and accommodation, and much research into children's experiences is focused on older children, with the wealth of literature on young adults' experiences post-care. And there's virtually no research that is focused on the needs and experiences of babies and very young children. So we're hoping we'll be able to add considerably to this gap in the literature. I'd like to explain a bit about the structure of the study before I go on to present some of the findings. The study really was carried out in 2 phases, and in phase 1, Pathways to Permanency, Multiple Placements, we obtained SOS care data for the full population on the 31st of March 2000 and again on the 31st of March 2002. And this is the data contained in the Social Services Administration System, and it gave us information on things like the children's placement histories from the point of time at which they entered into care up until March 2002, and also information on factors such as date of birth, gender and legal status. We also updated the placement status for the full population on March 2004 to give us 3 reference points, which were 2000, 2002 and 2004. And in the next phase of research, as I'll describe at the end, we aim to carry out another SOS care download for 2007, which will give us a 7-year period so we can examine placement patterns and outcomes from 2000 to 2007. But for purposes of today, we'll be presenting 2000 to 2002. We also explored case files of all of the children in the population and extracted data on factors such as reason for entering into care, child and family background factors, anything to do with health and behaviour and so on. So in total, between the SOS care data and the case file data, we've really rich baseline of information on this population, and we have over 70 variables that allow us to look at how certain factors relating to the children can impact or relate to outcomes and how children are getting on in placements. In the second phase of the study, we looked at the carers' perspective. Carers were asked to fill in the Strengths and Difficulties Questionnaire and the Parent Stress Index short form, and they also took part in some interviews. And this phase of the research involved 56 foster parents, 51 adoptive parents, and 7 parents of children who've been returned home. Because there is so much within that interview data, we have interview data for adoptive parents, foster parents, and birth parents. We decided that it probably wouldn't be wise to present all of that information here in addition to the rest of the information, but we do plan to present that at a later stage over the summer, and if anyone's interested in contacting us, we can be sure to provide you with information on that. But in terms of how the children are getting on, for today we're going to be focusing primarily on the information given to us from the questionnaires we gave to parents. So just an overview of the structure of today, we're going to look at what we found about the key placement outcomes for the population, what if anything predicts these placement outcomes, and how the children are getting on in their placements. So in terms of key placement outcomes, when we looked at placement across the 3 time points, we found a major decline in the percentage of children remaining in foster care, and that went, you can see there, from 61% in 2000 to 22% in 2004. Although the percentage of children at home has increased, you can see that care with birth parents has increased from 14% in 2000 to 27% in 2004. The rate of that increase has declined over the period. So that seems to be indicating that children who stay in care longer are less likely to return home. You can see under the sections at the bottom there, 3% of children were in prospective adoption placements in 2004 and 38% in adoptive placements in 2004. And that went from 0 in 2013 and 2000. And that really represents over 40% of children being in adoptive or pre-adoptive placements in 2004, which is a very high percentage to be in those placements, and really indicates option as a key permanency option in Northern Ireland. And that's interesting because 5 years prior to the start of this study in 1995, Kelly and Coulter found that there were extremely low numbers of children, like literally handfuls of children were being adopted from care. So it's quite an interesting finding. We also looked at the children's main placements in 2004, and we found that 43% of the, as described in the last one, we broke it down so that it would be a little bit clearer. So all of the at-home placements were put together, all of the adoptive type placements, and all of the foster cares put together. And we can see that there's, again, a very high percentage of children in adoptive placements, and much higher than any other type of placement in 2004, with relatively equal numbers of children either at home or in foster care at either 28 or 29%. So that's an interesting finding as well, because it's showing us the trends in placement outcomes for this population. We wanted to see a little bit about continuity of placement type over the period of research. And we looked again at children at home, adopted and in foster care, and whether or not they were in the same type of placement in 2002 and 2004. And we found that a very high percentage, 87%, were in the same type of placement over the two time periods. So that's an interesting finding in itself, because it does indicate a certain amount of stability or continuity in types of placement. We looked again as well at movement between placement types, and we found that there were a few types of placements that were more or less likely to lead to certain other types of placements 2 years later. For example, children who were in relative foster care in 2002 weren't adopted by 2004, so none of those children ended up being adopted 2 years later. We also found that a higher percentage of children were placed in relative care in 2002. A higher percentage of these children were at home in 2004 than those in non-relative foster care. So relative foster care was more likely to result in a placement at home 2 years later. And if you weren't already in relative foster care by 2002, you weren't likely to be there in 2004. So that's interesting in itself. So we're beginning to get a picture of the types of placements that are more or less likely to lead to other types of placements. So just to summarise on our first research question, which is what are the key placement outcomes for the population? Adoption was the main placement outcome in 2004, and the high percentage of children who were adopted by this time represents a significant shift in use of adoption as a key permanency option in Northern Ireland. We had seen also a major decline in children remaining in foster care from 2000 to 2004. We found that children who stay in care longer are less likely to return home, and also that the majority of the population, 87%, were in the same type of placement for both 2002 and 2004. So again, over the course of the summer, we're hoping to tease out the implications of those findings in a bit more detail. So the next research question was, what, if anything, seems to predict the types of placements that children are going into? And we conducted a number of chi-square analysis to identify which factors were, if any, significantly related to placement type in 2004. And we found a total of over 70 variables, so all of our baseline variables, the variables in this table were the only ones that were significantly related to placement type in 2004. So you can see that it's factors such as trust area, the reason the case was first opened, the child's legal status in March 2000, the age they were when they were first looked after, the length of time the case was open in March 2000, and also factors such as whether they had asthma, reflux, behaviour problems prior to March 2000, and also substance misuse within the family was also significantly related to placement outcomes. So that begins to tell us a little bit about the types of things that seem to be influencing or significantly related to placement outcomes. But I'd like to explore some of those in more detail, just to give you a better sense of what that seemed to be related to. So one of the interesting, significant relationships there was that the placement type in 2004 was significantly related to the 5 new trusts. There was quite a lot of variation when we looked at it between the trusts and according to trust. For example, we can see that if you see the southern board there, that row, you can see highest percentage of children adopted of all of the trusts at 73%. And that's much higher than the percentage of children either at home and especially the percentage of children in foster care, which is 7%. So they have the highest percentage of children in adoption and the lowest percentage of children in foster care in 2004. So that's an interesting observation. And we can see as well that the Western Trust has almost exactly the opposite pattern. They have the highest percentage of children in foster care in 2004 and the lowest percentage of children in adoptive placements in 2004. So that's interesting. So it's almost like a complete reverse pattern. We can also see that the South Eastern Board has the highest percentage of children at home. And interestingly, the Belfast Trust has roughly equal proportions of children in each of the different types of placements. So that's an interesting finding, really, because when we looked at it in a bit, well, we have to work it out. We had examined this now in relation to previous boards and trusts, and we didn't find too many factors that seemed to be able to explain this regional variation. So it's something that we would like to explore in a lot more detail, and again to explore within the context of the new trust to see if that's still the case and what might be causing those differences. This is just a bar chart to represent and display perhaps a little bit more clearly patterns. So we can see that for the whole section there, the South Eastern Trust clearly has the highest percentage of children at home. Also for the Southern Trust quite clearly has a really high level of children adopted and a really low percentage of children in foster care. And again, at the end there in the foster column, you can see how much higher percentage of children are in foster care in the Western Trust. So it's beginning to show some interesting things. Another interesting relationship was that the reason that the child's case was first opened was significantly related to the placement type in 2004. Again, sorry to be bombarding you with a lot of tables, but I can sort of try and help you talk you through this table, but we can see that neglect was by far the highest or most common reason for a case to have been opened. And you can see that 54% of the children in foster care, 47% of the children who were adopted, and 35% of the children at home had their case opened due to neglect. Almost the opposite pattern is true for children at home. Actually would have a higher percentage of having their case opened due to abuse than children who are adopted in foster care. And if you can see, that pattern is inverted. So children in foster care had a higher percentage of being brought into care because of neglect-related reasons. So that's something we want to kind of tease out a bit, i.e. why are children who come in for abuse-related reasons more likely to be at home, and why are children who come into care for neglect-related reasons more likely to be in foster care in 2004. Another notable finding is that, and it's probably an obvious finding in a way, is that that a very high percentage of children who ended up being at home in 2004 had come into care originally because there was an identified need for parental support. So we're beginning to sort of find certain patterns that can tell us a bit more about why certain children are ending up in certain types of placements and what are the relationships between placement and factors such as the reason the child's case was opened. Again, we have a bar chart, and I think this bar chart really shows quite clearly the degree to which neglect was the main reason for the children coming into care, especially for the children in foster placement. You can see it going up according to placement type. And conversely, this little one here, the abuse column, we can see it as well. It's higher for home, then becomes less for adoption, and then less for foster care. And again, the high percentage of children who are at home having come into care due to parental support reasons. Again, we found that the age that children were when they were first looked after was significantly related to the type of placement they were in 2004. Particularly here, one of the main findings in this really is that children who are less than 1 year old, when they first come into care, are significantly more likely to be adopted in 2004 than children who come into care when they're older. And each added year, so if you're 1 to 2 years old, say if you're less than 1 year old, you're 70% of children less than 1 year old were adopted in 2004. That dropped to 22% of children who were 1 to 2 years old when first looked after being adopted in 2004, and only 8% of children who were 3 to 4 years when first looked after being adopted in 2004. So that's interesting as well, because it really highlights that the younger the children are, the more likely they are to be adopted. Again, we see that the younger the children are when they first come into care, the more likely they are to be at home. But that's not as striking a finding really. When you compare 45% of children under a year old being at home in 2004, it's higher than the other age groups, but still not anything as striking as the 70% of children who were adopted having come into care at less than 1 year old. And again, another chart just to highlight really how much higher percentage of children who've been less than 1 year old being adopted, and how this blue column drops significantly with added age. So that was all very well, but it didn't really tell us very much about what predict or increased the odds of a child becoming adopted or returning home from care during the period of the research. And we used event history analysis to examine if there were factors that did predict this. And we did this based on case file data and soft care data, and it was for the 2-year period between 2000 and 2002. And we tested 2 models, and one was for adoption and one was for return home. And we didn't actually do a model for the foster care population, and that was because in order to conduct the event history analysis, we needed an exact date at which the child had actually achieved the event of having come into long-term foster care. So if that makes any sense, I'm not sure if it does, but so we had a date for the children at which they became adopted or at which they returned home. So because of the difficulty in establishing when exactly a placement turns into a long-term foster placement as opposed to being a short-term foster placement, because that's quite a grey area. But it's something that we certainly hope to be able to address in our next phase of research, and we hope to carry out another event history analysis for the period between 2000 and 2007, and to work on developing a way of being able to include the foster care population. Perhaps by, for example, specifying some kind of cut-off point based on how long they're in placement and what their care plan states. But for the purposes of this anyway, we had the 2 models, one for adoption and one for return home. And this allowed us to examine the time that went by before the child was adopted and returned home, and also to explain why some of the young people were at a higher risk of either being adopted or returned home than others. We used Cox proportional hazards regression to do this, and used all of the child and family backgrounds outlined earlier in order to see which, if any, of these were increased the likelihood. Of all of our children, 68 actually were adopted in between 2000 and 2002, and 43 were returned home during that period. So the following sort of statistics and information is based on the fact that those numbers of children were actually in those placements. So again, another table full of information, but I'll just talk you through it briefly in that these variables here are the variables that actually significantly predicted and indicated an increased likelihood of being adopted in 2002. So children who weren't on the Child Protection Register prior to the start of the study were 4 times more likely to be adopted than those who were on the Child Protection Register. If a mother was under 16 at the time of the child's birth, that child was 5 times more likely to be adopted than those whose mothers were between 17 and 21. And again, children whose mothers were under 16 were 4.5 times more likely to be adopted than those whose mothers were between 22 and 30. So that really gives us a flavour of the exact degree to which children were more or less likely to be adopted. Again, the finding in and around the age of the child. So children who were less than a year old when first looked after were 2.5 times more likely to be adopted than those who are 1 to 2 years old when first looked after. At the bottom, it makes this table a bit longer, but we did want to include some of the findings that weren't significant but still give a sense of having increased the likelihood of children being adopted. And we didn't want to throw these out altogether because in our next analysis we hope to see if these are more or less significant or more or less likely to have influenced the likelihood of being adopted. But it's things like family circumstances, being in the northern board as opposed to the western board, whether or not the mother lived alone, for example, that was found to be 2.5 times more likely to increase the chance of adoption than if the parents were living together. If the child had behavioural problems or the length of time the case was open. So factors like that were also increasing the likelihood of the child being adopted, but not necessarily to a significant degree. And again, the return home model, we actually found that, you see the blue ones here, as with the last one, these are the significant ones, and there's slightly a greater number of variables that were significantly increasing the likelihood of a return home. For example, if the child didn't have a family history of alcohol abuse, they were 3 times more likely to return home than children who did have a family history of alcohol abuse. If a child was in the eastern board, they were 6 times more likely to return home than, for example, those in the northern board. And that begins to tie in as well with our previous finding about the relationship between placement outcome and trust. So in a way, the findings seem to be kind of creating a picture, which is interesting. Again, if the age of the mother was under 16 at the birth, they were 10 times more likely to return home than children whose mother was aged between 31 and 40 years at their birth. And if a case was open less than a year at the start of the study in 2000, they were 25 times more likely to return home than those whose case was open 3 to 4 years. So that begins to show us the odds, in a way, of the child either returning home or being fostered. And it's something we're very keen now to follow up on for the 7-year period. And we hope that that will really provide us with a much clearer picture, because by 2007, a lot more children will have either been adopted or returned home. So we'll be able to get a clear picture of all of that. And to summarise now, I'm sure you're delighted not to see another table, but just to summarise what predicted placement outcomes in our research. We found a number of factors were significantly related to placement type in 2004, and these included trust area, why the case was opened in the first place, the child's legal status at the start of the study, the age they were first looked after, whether or not they had asthma, reflux, behavioural problems, and also a family history of substance misuse. So now we've identified those factors as being significantly related to placement type. We also, through our event history analysis, identified a number of factors that increased the likelihood of either adoption or a return home. And for adoption, the factors that increased the likelihood of being adopted were if the mother was under 16 at the child's birth, if the child was less than a year old at the start of her study, and if the child wasn't on the child protection register. And factors that increased the likelihood of a return home were if the child didn't have a history of alcohol abuse, if they were in the Eastern Board, if their mother was under 16, and if the case was open less than a year at the 31st of March 2000, which was our starting point. So our job now really is to try and make sense of those findings, to see what the implications of those are for practice, and then to follow up in our next phase of research to see, is that still the case? Are there other factors that seem to be more or less likely to predict placement outcomes? But at least it's beginning to give us a really clear picture of the types of factors that predict placement outcome. So our third question then was, how are the children getting on? Now we know really what types of placements they're in, how are they getting on within those placements? And as I mentioned earlier, we gave the parents the strengths and difficulties questionnaire and the parent stress index short form to complete. And this was completed as part of phase 2, which I described earlier, investigated the parents' perspective and involved 56 foster parents, 51 adoptive parents, and 7 parents of children who'd been returned home. Now these 7 parents of children who'd been returned home aren't included in our analysis as the numbers were too low for inclusion. So we'll be focusing on the foster parents and the adoptive parents and looking at those two groups and seeing are there really any differences between the two groups in terms of how they're getting on the two forms. And I'll explain what those two questionnaires are in the next slide. But what we did was we carried out analysis of variance to see whether there would be any significant differences between these groups in terms of how they're getting on from the perspectives of the carers. So we chose the parent stress index short form because it's a measure of stress in the parent-child system, but it also kind of tells us a lot about how the parent feels they're getting on with the child, how they're feeling in their role as a parent to the child, and also how they feel the child is getting on within themselves. It gives us a total stress score, and it's made up of 3 scales, primarily made up of 3 scales, which are parental distress, which tells us about the distress the parents are experiencing in their role as a parent. It also gives us some insight into one of their scales, which is parent-child dysfunctional interaction, and that looks at parents' perceptions that the child either does or doesn't meet their expectations, and it gives us some sense as to how rewarding they perceive the interactions with the child. And the difficult child scale allows us to look at the parents' experiences of basic characteristics of the child that make them either difficult or easy to manage. So we compared the scores for the adoption group and foster care group, and we found that there were significant differences between the two groups on 3 of the scores. That was the parent-child dysfunctional interaction, where the foster group was significantly higher than the adoptive group in terms of that dysfunctional interaction. We can see that the foster parent score was on the 90th percentile, which is considerably above the mean for parental scores on that particular questionnaire, whereas the adoptive group were on the 50th percentile, which is just at the mean. So adoptive parents were just around average with parents in general on the score, whereas foster parents were considerably higher. Again, with the difficult child score, there's a significant difference between how difficult adoptive and foster parents rated their children in 2004. And the foster parents were on the 70th percentile, which is again well above the mean, whereas the adoptive parents were below the mean for parents in general on this scale. And again, the total stress score, foster parents scored significantly higher again than adoptive parents, and they were on the 65th percentile, which again is above the mean, but not quite as high as the other 2 scores previously. And you can see the adoptive parents are really quite low below the mean for general population of parents. So it begins to give us a sense of differences between adoptive and foster parents in terms of how the parents are rating the children as getting on, and how they're really finding it themselves within placement. So as we've just seen, those 3 scales, the parent-child dysfunctional interactions, child difficulty and total stress, demonstrated significant differences between foster and adoptive parents. And foster parents were showing higher levels of stress or difficulty in each of those 3 scales. It really indicates a high foster parent perception that the child doesn't meet their expectations, and the parent-child interactions are not rewarding for the parent-child dysfunctional interaction scale. For the difficult child scale, it indicates that foster parents find their children more difficult to manage than adoptive parents. And for the total stress, it indicates that foster parents are experiencing more stress in their role as a parent than the adoptive parents. We looked as well at the strengths and difficulties questionnaire, and this is a brief questionnaire that's completed by parents, and it allows us some insight into their perceptions of how the child's getting on in a number of different domains, including emotional symptoms, conduct problems, hyperactivity, peer problems, and personal strengths. For example, it gives a measure of the parents' rating of the child in terms of their pro-social behaviour, how kind, generous they are to other children, and so on. We found that there were 2 significant differences here between foster parents and adoptive parents, and these were in conduct problems, where foster parents rated their foster children as being significantly higher in conduct problems than adoptive parents rated their children. And in terms of pro-social behaviour, adoptive parents rated their children as being significantly more sociable than foster parents rated their children. However, there are some scores here that indicate that foster parents and adoptive parents were fairly similar as well. For example, we can see here that the hyperactivity scores are quite high for both foster and adoptive parents, and there's very little difference between the two. And in fact, once you get to a point of 5, it moves into the category of potentially indicating a significant problem with hyperactivity. So that's an interesting finding. So both groups seem to be particularly rated highly in terms of hyperactivity. The two groups as well were quite similar in terms of emotional symptoms. Again, falling within the sort of normal ranges such with the general population. There's not that much different either in the peer problems measure. So in a way, the major difference really is the conduct problems and the pro-social behaviour. And in a sense, neither of these scores really indicate a very clinically significant difference as such, or they don't indicate major threat or risk of problems for the two groups, apart from the hyperactivity is approaching a sort of a dangerous stage as such. So as I described there, foster group scored higher on each of the difficulty measures, suggesting that parents rated foster children as experiencing a higher level of personal difficulties than adopted children. The adoptive scores, though, weren't too far behind foster scores on emotional symptoms, hyperactivity or peer problems, indicating that adoptive children are also experiencing some difficulties. Again, as I mentioned earlier, the hyperactivity scores were within average range, but almost at the cut-off point for being at risk of being clinically significant problems. So that's a little warning sign there for hyperactivity. And again, the two significant differences as I outlined earlier. So just to summarise what that sort of seems to be telling us about the differences between the two groups in terms of how they're getting on in their emotional and social development, and also stress in the parent-child system. The adoptive scores are lower than foster scores on every measure of the two scales, except for they're higher on pro-social behaviour. So this suggests really that adoptive parents are experiencing less difficulties with the children and in their role as a parent to the children than foster parents, and also that adoptive parents rate their children as being more pro-social than foster parents rate their children. Conduct problem scores and to a lesser degree hyperactivity scores were concerning for both foster and adoptive groups. And it's interesting as well that the difficult child scale and the conduct problems were significantly higher in foster than adoptive children, and those are scales from each of the two questionnaires. And that really indicates the extent to which foster parents rated children as more difficult to manage than adoptive children. However, we would like to sort of specify a warning in and around these findings in that it doesn't really allow us to examine the differences in terms of the child's age at placement, how long they're in placement. And we know that these factors are important and could have influenced the differences between the group. And it could simply reflect the fact that adoptive children were perhaps in their placements for a lot longer than foster children, and therefore they could have been a lot more settled within those placements. And could have got over that period of perhaps adjustment. So it's something we'd like to keep an eye on in the future as well. And again, we'd just like to say that these are parental ratings and don't tell us really about how the children rate themselves on these dimensions. And it's not an independent rating either. So it's something we'd like to explore in a bit more in later stages of the research. Which brings me on nicely really to just to tell you a little bit about the next phase of our research. The next phase is focusing exclusively on the children's perspective. It's been funded by the R&D office and will take place between 2006 and 2009. This new stage of the research will allow us to update placement status for the 31st of March 2007. So we then have 2000, 2002, 2004 and 2007. So that will be 4 time periods with which we can compare placement patterns and outcomes over the course of the study. We're intending to repeat the measures we used previously to give us a sense of continuity for that as well, and to see what has changed over the time period since 2002 and 2004. We're going to update our analyses, for example, our event history analysis, to get a wider time range really, so that will allow us now to look at the placement, what predicts or increases the odds of hopefully adoption, return home and foster care based on information from the point at which the children came into care until 2007. And importantly then, we're going to explore children's perceptions on how they're getting on with the placements. And really, we're interested in their ideas on family identity, where they belong, what they see as their future, and what their ideas are around permanency. So we're hoping to speak to children from each of our main placement groups. So really, that's it. We'd be interested to hear if any of the findings are of any relevance to practice or to design that you would find useful for us to perhaps look at in the next phase of research, because it's still in development, and you know, it would be interesting for us to hear ideas as to, based on what we've done already, what we can best do and be sure to incorporate in the next phase of research to be useful. So I'd like to say thanks very much for listening, and that's it really.
Thanks very much, Emma, for this really interesting presentation. And you've got the chance now to either ask questions or, I believe, influence the project, or at least make suggestions in what direction it should go. So any questions, if you have any, or any suggestions or comments, please.
It just strikes me that the work looks very useful, so firstly, thank you for it.
That's great.
Secondly, maybe a parallel with fostering and maybe adoption is that men tend to be obviously absent from that picture in terms of the determinants about whether people are moved into care or coming out. You know, the mother being 16 or up to 40.
Yeah.
It's very hard to remember all those figures now.
Yes.
And also be useful maybe if we could get it. It's actually quite hard to read this.
Okay,
I
yeah.
don't know what people feel, but yeah, it's quite hard.
Okay.
A third thing that struck me maybe in terms of the difference between the figures is the type of fostering. For instance, if people are fee-paid, they might be attracting a more difficult type of child, or a child who has more difficulties, I think, just to phrase that differently. And of course, in all research, there's always politics, really, where people can exaggerate one thing or underestimate something else, maybe pride involved. As a foster, as an adopted parent, I may not want to say I'm having difficulty to a researcher, so just some other variables, really.
But in terms of fathers, we had quite a number of variables that talked about fathers. You know, was the father living at home? Was the father with the mother? What age the father was at birth? Was the father working? There was quite a number of those variables, but it was just that none of them actually turned out to be significant in those analyses. Isn't that right? Yeah. So it'd be interesting to see at a later date were any of the father variables significant when we go back in 2007 and rerun the analyses. You're perhaps right about the pride thing, and it's something that we, in a way, we explored to a certain extent in the interview data. When I suppose it was a shame in a way that we weren't presenting the interview data, but I think it would have really been too much to go through each group of parents today, as well as some of the other findings. But when you spoke to the parents, there didn't seem to be as much the impact of the difficulties that are indicated within the, say, for example, the stress score and also the strengths and difficulties questionnaire wasn't as striking from speaking to the parents as it is from seeing it on paper. So that's perhaps something that we would be able to explore as well when we come to writing up the findings in relation to the interview data as well, because I don't get a sense, because Dirk as well was involved in the interviews material as well, I don't get a sense that that, I suppose, would be just,
I mean, if you do, when you do have a chance, I mean, we intend to produce an executive summary possibly within the next month or two, and we will specify some of the issues that emerged during the interviews. But I mean, you will see when you look at the interview material that it doesn't depict adoption like as a bed of roses.
No.
You know, there are issues there, and
And I wasn't suggesting it was either.
Oh, no,
you know, I mean, the parents are quite explicit,
yeah.
the adoptive parents, in terms of the type of difficulties that they are experiences, as well as some of the positives of the adoptive placements. And I think it's just that when you compare the foster care with the adoptive on these sort of quantitative measures, it depicts the adopted children as doing slightly better, but they're not always doing that well. They're just doing better than and I think when the MF says the hyperactivity score, which suggests that a lot of the children in the adoptive placements are coming towards the abnormal range within that score, and it would suggest the need for continuing support for the children, which, as we found within the interviews, isn't always available to them.
Something that I maybe want to comment on that, which is quite striking, is the difference in trust, so that it really is different to the children where they live, you know, the outcome of where they end up in care. And the other one is, which is quite striking and perhaps fits well with discussions on adoption, you know, with celebrities and so on, that it seems that the ones that are ideal children, the younger ones, the ones that have no baggage, and so on, are really the people that are being adopted. So you wonder whether the trusts facilitate the parents more than the children. So that's something, you know, the parents' wishes, you know, who they want to adopt rather than who's most in need. You know, so that's maybe something you can say something about, or Dominic even.
It'd be interesting for
Something
us.
to look at.
Yeah. I think in the future it would be very interesting for us to explore those findings in the context of trust policy and ethos around the various placement options, and which trusts perceive which placement options to be preferable. I think might have some clue to where the children are ending up at the end of the day. And I suppose because our research really is crossing the period between the old structure of the trusts and this new structure, I suppose it'll take us just a little bit of time to incorporate the new structures and redo our analysis to explore a bit more in that way. But it's certainly something that we'd like to look at in more detail in the future.
Any other questions? Yes, please.
Can I ask, you did speak of questionnaires. Who else did you give questionnaires to? And can I respond to your reply?
Oh yes, sure. We
Through social services, I mean in a widest sense.
yeah. When we went to interview the parents, we also gave them the questionnaires at that point. A small percentage of the children had teachers complete the strengths and difficulties questionnaire, and also had social workers complete the strengths and difficulties questionnaire. But that wasn't done for all of the population, so we haven't included it in our overall findings.
Yeah. Well, I did see, and you did speak of, there was a small number, perhaps wouldn't, I forget the exact way you phrased it, but you said wouldn't register as whatever. But my concern is that in different charities for disabilities, and as a carer myself, and lots of parents are not chosen under this category because social services blocks it out because of corruption and because of perversion within any trust, and there is lots, and those families are not chosen, and okay, we might be a small category, but it still exists, and it's most important to include lots of children that are taken into care because of corruption and perversion within the trust, because we, you know, are equal rights to other kids.
I'm not sure if I understand fully what you mean, but am I right in thinking, do you mean in terms of how we approach the parents to take part in the research, is it?
I think it's important, whatever way you choose, to include as a carer, as a parent, to include our children, because of perversion within social services, that they're taking our kids, fostering or whatever, because of that. It's not because of drugs or whatever, and this isn't included in this.
I mean, I think you're maybe referring to the fact that we weren't able to include the data that we got from the birth parents within the analysis. I mean, that's to do with statistical power. Because we only had 7 birth interviews, we couldn't actually analyze that statistically in comparison to other groups which had 50. But I mean, I think we would like to emphasize that we see the return home group and those birth parents as an equally important facet of this study and an essential facet, because we need to really see what the alternatives are to care, to long-term care and adoption.
Yeah, well, the same applies.
Yeah, and we will be bringing, and particularly in the next phase, one of the problems was that we, whenever we were trying to interview the parents, the adopted parents, the foster parents, and the return home parents, the really children who had returned home by 2004, and we went through the same processes to try and get in touch with them. But they tend to be extremely difficult to engage with for a range of reasons. I mean, there were a number of interviews that we had arranged, etc., where the parents weren't there when we went out, or they refused to speak to us because they felt difficulty for ourselves in these situations is that it's hard to explain to people that we are objective and that we are
I appreciate I'm not criticising, I'm just widening the horizon because it's important as a parent, as a carer, as I said, that we are not forgotten about. Society believes these documents that we have a right to live.
And an important point on that as well is that you'll be probably delighted to see that within our executive summary and within the literature that we're going to be producing, although we haven't included the data on those 2 measures, but we have a very rich chapter on the actual interviews with those parents. So we have brought in a lot of their issues, and I think Dirk was responsible for doing the analysis for the report on that, and I think Dirk would agree that that a lot of the issues that the parents had with social services and their grievances, as well as some very supportive things that they had as well for the type of work that social services did with them and helping them get through particular problems that they had, such as alcoholism, being able to defeat that and help them get their children back. But there were also parents who were very candid about the problems that they had with social services.
It's just social workers and whatnot will block this area. Actually, there is a percentage of it happening in society, and we need recognition.
We actually tried to contact every birth parent of the children in our sample, as Dominic mentioned earlier, and there were a variety of reasons why we only got 7 in the end, and it was a total of 90 something at the start. 80, it was either 80 or 90, I just can't remember the exact figure, but that was the total number of birth parents that we tried to get into contact with. And I think we actually at the time spent months trying to follow up on them, and quite a lot of the birth parents, there was no longer information on their contact details that the trust could provide to us because they had already been returned home. Others had moved and so on, and the ones who we did have the correct contact details for, I think we must have tried at least 3 or 4, 5 even attempts in various ways to get in touch with them. And we were very sorry at the end of the day that we only had the 7, but as Dominic said, of those 7 that we actually interviewed, we feel like we've got a very interesting story to tell from their perspective. And just not to forget also that within the wider study, apart from the interview section was really sort of who we could get to interview sort of at the phase 2 of the study, but all of the data we referred to there, for the return home 2004 and so on, we had the full amount of data for the full cohort in terms of what the return home sample looked like, or children who were living with their birth parents or had been returned to their birth parents, what the picture for them looked like in terms of placement outcomes and what types of factors influence those placement outcomes. But as we, I suppose it's something that we're very keen to not forget or not to dismiss.
I appreciate that. It's just important to include charities as well, carers and different people that aren't part of what.
Okay, any other questions or comments, suggestions? Yes.
I think the analysis looks so daunting to me. It's just incredibly complicated, not least because it looks like trusts have different policies, and also because your outcomes aren't on any kind of obvious continuum.
Right.
When you were doing the comparison, what predicts, for example, adoption? What were you comparing them to? I mean, what's your sort of control? You weren't doing a regression or anything, you were doing a...
Event history analysis.
Right, okay, so people were more likely to be adopted compared with...
With, Dominic can correct me here if I'm wrong, but the children who had been adopted by 2002, it was how likely they were to be adopted based on their background factors, and I think originally all of the 70 or so background factors were included in that mix, and the statistical package identified a number of those variables which were more likely to have increased the likelihood of the placement.
It's relative to every little child in the sample.
It's relative to everybody else.
374 children were included in the analysis.
So it's just who gets adoption versus anything else?
Yeah, I mean, it may be a slightly crude way of looking at it, or quite slightly crude analysis, because you don't get to see the nuance of how people get there.
Yeah.
But it does give you some strong findings in terms of the differences in terms of background between those that are adopted and those that are not. And I think one of the major findings that's coming out of it is the very, very strong differences between the trusts.
Well,
Some
I think
of the
that's,
trusts have very, very, very high
that'll be
levels, and
difficult
some
that
have
time.
low levels. I think that has implications for planning for children. I mean, essentially the outcomes that we choose for these children might be based on their needs.
Yeah.
And if the children within the different trusts are quite similar in terms of their needs, it would suggest that, well, it's quite difficult to work out how some children can be given an adoption placement and others kept at home, when essentially they're quite similar in terms of what their needs are. So I think there are implications there.
I mean, it strikes me you almost have to look at it within trust, because it looks so clear that there are policy differences, and then the variables will work in different ways. If one trust considers this as the best outcome, you know,